Deja, thank you very much. As COVID-19 cases continue to be out there, hospitals doing everything they can to help treat their patients despite an increase in hospitalizations recently. Dr. Hawkinson from the University of Kansas Health System joins us this morning, as he often does. Dr. Hawkinson, thanks so much for being with us this morning. We're glad to see you. On the KU call yesterday, it was mentioned the system went from 1 COVID unit to 2. Let's talk about the increase in cases right now and trends you're seeing. Obviously there's concern when numbers go up, but what's the concern level and the trend you're seeing right now with those cases?
Yeah, I think in the Kansas City metro area, the 7-day rolling average of cases is going up. The daily cases are going up as well. We know that hospitalizations follow those cases. What we also know is that people are getting tested less, so it's harder to rely on the actual case numbers rather than the hospitalization numbers. And unfortunately, what we are seeing is those hospitalization numbers are going up. We will be having a meeting with area chief medical officers as well to see if that trend is going on in other hospitals as well. But it's certainly a concerning trend considering where we have come from and the low numbers that we were seeing. Now a fairly significant increase in the overall hospitalizations.
Doctor, I want to talk to you about teenage vaccinations for COVID-19. We've been talking about it a lot this morning with the potential for 12 to 15-year-olds soon to be able to get vaccinated. Right now, you have to be at least 16. There's another major chunk of our population that could get that vaccination soon. It could be approved within the next few days. Talk about what impact you would expect that to have if 12 to 15-year-olds were able to start getting vaccinated on a mass basis.
That will be a huge impact as far as our herd or population immunity goes, because right now all we're considering are those ages that are in that age group who qualify for those vaccines, and that's 16 and above. So we are keeping a large segment of the population out. If we're able to go into that other segment of the population, that pediatric population, that is going to be one more step towards getting towards herd or population immunity. But really what it is also decreasing the total number or amount of people that could potentially get infected and spread the disease as well. So overall, that is going to be a good thing.
I want to ask you about, because we're getting a chance to visit with more people now that more people are getting vaccinated, but if we get a chance to visit with another family, let's say, and go see someone we haven't seen in a while, as adults, say my wife and I are vaccinated, the other adults are not that we're going to see. Should I be nervous about taking my kids? Because obviously my children are not vaccinated. What about kids who are unvaccinated being around adults who are unvaccinated, even in outside situations?
Yeah, you're exactly right. That is a concern. A lot of the guidance from the CDC, does really also focus on, although it kind of gets lost, does focus on the whole household being vaccinated. So it is important to get those children vaccinated as well. Being able to meet with another unvaccinated family will help if your whole family is vaccinated and has that protection, because although we do know children are less likely to go to the hospital and suffer severe disease, there is that chance that they can get that multi-system inflammatory disorder.
Right.
There is that chance they can still have the long-lasting effects of COVID, the fatigue, the brain fog, the muscle aches, even with mild disease or no symptoms at all. So it is important to get your children and anybody who is a potential host for this virus to get vaccinated. And this is one more step towards doing that for the country as a whole.
Doctor, one last quick question I wanted to ask you before we let you go. The term herd immunity is, I think most of us have not even heard that before this year. Can you give us an example of something we already have herd immunity to and maybe just have never talked about it? Is the flu one of those things? What's something we have herd immunity for?
No, absolutely not. Respiratory viruses like influenza or the other common cough and cold coronaviruses or RSV is not herd immunity. What we're talking about when we talk about population or herd immunity, we're looking at things like chickenpox. And before the vaccine, most all of the children had gotten the disease when they were very young, so that as they get older, they are immune. As they become adults, they're immune. Other things include measles, mumps, and rubella now, which in the United States, we have very good vaccination coverage because of that. So it keeps our children well. And as we grow into adults, we still have immunity. Some things that children have more herd immunity or population immunity to are things like pertussis, because they are getting vaccinated. So we are vaccinating ourselves out of that. Yep. But as adults, we lose our immunization, we lose our immunity to that. So it's important for every adult to make sure and talk with their medical team about getting the Tdap vaccine, which has that component of pertussis in there, because what we see is that it's maybe grandparents or other older loved ones who spread it to the newborn babies because they don't have immunity. So there are very good examples of herd immunity. Most of those things we understand it's because of those vaccines that we're able to get.
All right, Dr. Hawkinson, as always, thank you so much for joining us. We appreciate your time and your insights. Dr. Hawkinson joins us live every Tuesday morning here on 41 Action News Today. Also, he's always part of the Daily Call with the University of Kansas Health System. That starts at 8 a.m., and you can watch it on the 41 Action News Facebook page. We'll be back.